I think we're all aware of the constant need for blood donations. Connecting Point correspondent Carolee McGrath met with Anna Pirelli, Western Massachusetts District Manager for the American Red Cross, to learn more about how we donate blood for those in need, the requirements each blood donor must meet, and how the blood we give can literally save lives on a daily basis.
When somebody needs a blood transfusion, there's nothing else that can be given to them. It has to be that life-saving blood that can only come from a volunteer donor.
And when that number starts to dip, it doesn't just happen in January. You were saying it also happens in the summertime as well?
The summer is also tough. So another reason January is tough for us and the summer is we lose a lot of the high school and college donations. And they account for, anywhere between 20 to 25% of our blood collections throughout the year. So when we lose those students, it really has an impact. And in the summer, people are busy, people are on vacation. If we have a site that doesn't have air conditioning, we can't run there. So that we face a lot of challenges different times of year. The challenge we have in the winter is obviously the snow. So if we're running at a high school and we have that school is closed because of weather, then that's one whole blood drive that we're not collecting at.
So tell us about the process. What do you do when you walk in? You're a volunteer. Just walk us through it.
So when you come in, we give you a packet of reading material, and that material is meant to educate the donor and to kind of pre-screen a little bit. So we want people to understand the process and to know who can and can't donate. And we actually have what we call our stop sign. So it's basically the bullet points for the most common deferrals. So please do not donate today if you're not feeling well, if you've taken antibiotics in the last 48 hours for an infection. So different things, if you've had a tattoo in the last 12 months. So different reasons why people are commonly deferred. And then after they do their reading, if they do the reading and are comfortable to move forward, then we do like a mini physical. So we ask a series of about 50 questions, and they range from, are you feeling well today, to have you traveled to Africa? And so a lot of different questions. And those questions, again, are meant to pre-screen the donor to make sure that it is safe for that donor to donate for them and that that blood is safe to give to a patient. So there's a lot of pre-screening involved. We also check the donor's blood pressure, temperature, and iron, again, to make sure that it's safe for them to donate. If blood pressure is a little high, iron's a little low, we're not going to let that donor donate that day because we want to make sure that it is safe. And donating blood is perfectly safe. And then afterwards, so that's actually the most time-consuming part of the process. And then they're off to the donation, which is about anywhere from 10 to 15 minutes, some people a little bit less. We take just under a pint of blood, and the average adult has 10 to 12 pints in their body, so they don't really miss what we take. And part of how we know how much blood they have is that iron level that we check. And then the best part is juice and cookies at the end. For 15 minutes, we want to make sure that people are feeling well. Sometimes people don't feel well after they give blood, and it's not blood loss that causes that. It's actually dehydration because we're taking a pint of fluid from somebody very rapidly. So we actually encourage people to be very well hydrated when they come in. We actually give them a bottle of water while they're doing their reading to kind of get a head start on that, but most people do feel perfectly fine afterwards.
And from that one donation, tell us how can that blood be helpful to people who need it?
So one pint of whole blood can actually help save the lives of up to 3 patients because we separate that blood into 3 components: red cells, platelets, and plasma. People generally don't need a transfusion of whole blood. So depending on what the patient's issue is, they will need one of those components. So for example, somebody who's been in a car accident who suffered a lot of blood loss, or somebody who's lost a lot of blood during surgery might need red cell transfusion. And your red cells are what carry oxygen to all of the cells in your body. So as you can imagine, if you don't have enough red cells, your cells aren't getting oxygen. Very important. Platelets, which is the clotting factor in your blood, they're very sticky. Cancer patients use a lot of platelets. Chemotherapy, cancer patients actually as a group use a lot of blood. Chemotherapy kills cancer, but it also kills healthy cells. So oftentimes patients need transfusions when their blood levels get low to get through those life-saving chemotherapy treatments. And plasma can actually be frozen for up to a year, and that typically will go to somebody who's in shock or maybe a burn victim. But they also use components of blood to make a lot of medications, and that's something I think people don't realize. We have somebody who works with us. Her son, who's 17 years old, has an immune deficiency issue, and he requires infusions every 21 days.
Wow.
Of and the medication is made from antibodies from blood products, and it takes thousands, tens of thousands of donations to get medication for one infusion that he needs every 21 days. Lives a healthy life. You'd never know he was sick.
But it's critical for him.
But if he didn't have donors coming in and donating that blood, he wouldn't be as healthy and he wouldn't be playing sports and your average teenager that he is today. So people often think of the car accidents, the surgeries, the immediate need, but there are a lot of people, a lot of different issues. Sickle cell, people with sickle cell anemia often require blood transfusions to get through their crises. And if they go through a bone marrow transplant, there's a lot of blood transfusions involved there. So there's a constant ongoing need for blood out there.
Anna Pirelli, thank you so much for joining us. And if people want to find out more information, just tell us your website.
RedCrossBlood.org, or they can call 1-800-RED-CROSS.
All right, thanks for joining us.
Thank you so much.